Hello, all dear viewers. I'm Dr. Musthafa Ashraf. I'm consultant, Department of Internal Medicine, Pratima Hospital, Kachiguda, Hyderabad. So, today's talk would be on the present scenario. Our country is dealing with the third wave of the COVID-19 infection, and the newer variant what we have is the Omicron variant. So, as previously in several talks or in many articles, you might have found out that this variant is very contagious, highly contagious, and the transmissibility of this virus is very rampant. And as we have been seeing, say, over the last period of couple of weeks, the spread has been rampant, and given at this point, almost 75 to 80% of the whole population is getting affected with this infection. Though the investigation, the test wise have been not so aggressively been done, but the signs and symptoms remarkably show that it points out that this patient is definitely suffering from all those symptoms which are Omicron variant carrier infection suffers. So what does these kinds of infection patients coming to our regular OPD, what we have found, symptoms are very brief. The most striking point would be a sudden cold with a severe headache, generalized body aches, and sudden weakness. These are the basic symptoms, and a lot of scratchy and itchy throat might be associated with cough. So what needs to be done that time? So you need to get your RT-PCR test done first, and if found positive, Government of India has laid down clear guidelines for the treatment of this third wave Omicron variant, because as majority of the Indian population is heading towards almost complete vaccination status. So the good advantages is the Delta variant, the population is almost immune, and the Delta variant doesn't seem to be, taking that much of the severity in the population. Though minor cases have been reported and they have been hospitalized. So what all the simple basic things what you need to follow, as I've previously told in my previous topics, that proper mask wearing techniques, avoiding going to the overcrowded areas, and if a patient who is coughing or sneezing, do not shake hands, maintain social distancing, and practice proper hand sanitization techniques, and proper taking care of your surrounding hygiene and environment. So what happens during this infection? Many things have come. Okay, this drug, new antiviral pills might help, and other things. Many authorities have issued molnupiravir with a great lot of warning. ICMR has also indicated that molnupiravir should not be used or abused to such an extent, because as it has got a lot of side effects, especially for the population who are in their reproductive life, might cause birth defects in children as well. For both males and females it happens. So unless and until there is a need, people who are suffering with comorbidities like hypertension, diabetes, cardiac illnesses, renal problems, so these patients needs to be treated at the OPD basis. So what if a patient presents with, suppose, who is already a vaccinated person and who is suffering from shortness of breath, or lot of cough, or decrease in oxygen saturation? Yes, patient needs to be admitted, as the severity of the disease is definitely decreased with vaccination. But when these signs of hypoxia, lack of oxygenation, patient suffers shortness of breath, patient gets shortness of breath, so that time patient needs to be admitted, treated accordingly with the guidelines provided by worldwide authorities, WHO and Indian society guidelines have been issued. So still it is not the time to pull down your mask and roam around freely. India has still not achieved the peak. The peaking would be somewhere around in the end of January or in the first week of February. So till then, it is a very crucial point where everyone, particularly children and the elderly, needs to take extra precaution, in saying protecting themselves from this infection as well. And for outpatient treatment, the treatment is not so complicated, not so expensive. It is very symptomatic and can be taken care. But if a person whose condition worsens, or a person who is not vaccinated and gets complication requiring admission, then we at Pratima Hospital, I am being in charge of the department. We provide excellent, comprehensive COVID management services and facilities for the betterment of patient and for faster recovery from this dreaded infection. Remember always, if you feel your symptoms are going worse, do not delay. Please report it to your physician and get proper care. So my today's take-home message for you people is, do not neglect or consider Omicron variant as a common cold. It has its own effects, which might not show immediate effect on your body, but in later course it might be harmful for you. But still, people who are not vaccinated needs to be vaccinated. And if these symptoms, the Omicron variant symptoms, can be easily managed, you need to have a supervision of doctor. You cannot take medicines on your own, not try some experimental approaches. And taking treatment which are mentioned in the guidelines helps you, in a safe recovery, rather than carrying a lot of side effects and worsening quality of life and delay in recovery. So my humble request to all my viewers is, consult your physician first and take his advice and do as what he advises for you, as getting tested first, then taking the treatment makes a lots of difference. And with this message, I wish you all a very healthy life in coming days. And I'm quite sure, and I expect that you will take definitive precautions, as Government of India has laid down strict guidelines. And Government of India itself is trying their best to fight out this vaccination. And if people cooperate, our citizens of India, we cooperate together, we can attain a herd immunity as well, and we can prevent this third wave from becoming a disaster and making it in the milder form, and it passes away. Thank you all, and wish you a safe and healthy life. Thank you so much.